Hi, Dr. Michael Richie. Let's talk about droopy eyelids. Very common problem. The upper eyelid skin over time and with the effects of gravity and family history can start to hang over the edge of the eyelid margin. And this gives sort of a hooded effect. The excess skin hanging down can block your peripheral vision, and it kind of gives that sad, sleepy puppy dog look. Well, that's a problem that we can fix. Now, typically, insurance will help pay for this if we can show that this problem is blocking your peripheral vision. You may have already had your testing, where we do a test where we measure your peripheral vision, then we use a tiny little piece of tape and lift the lid up, repeat the test. What we're trying to do is show the difference in your upper peripheral vision with your lids in normal position compared to what it would look like if we did surgery to fix it. If we can demonstrate a big enough improvement in your vision, then this becomes a surgery to make your vision better, and insurance will pay for it. Now, if you don't have that much improvement with the lids taped, you can still choose to have the surgery. It would simply be considered cosmetic, and insurance wouldn't help with it. So let's talk a little bit about what we do surgically. So the first step is we're going to mark the eyelids so we know how much excess skin to remove. Then we'll take you into the operating room, we'll give you some sedation through that IV, and then we'll numb up the skin. Very simple. From that point on, we remove the skin, remove any underlying fatty tissue that makes your lids look puffy, and we sew it up. It takes us about 45 minutes to an hour. After surgery, when you go home, we do have a couple of things you need to know. Swelling and bruising are probably the two biggest things you're going to contend with. So here's how we deal with that. We have an icing routine that we'd like you to use. We have an ice pack that looks like a mask. It's got a Velcro strap, and we ask you to use this for icing. We want to ice 15 minutes out of every hour, day 1 and day 2. 15 minutes out every 2 hours on the third day, and then days 4, 5, and 6, it's 15 minutes 4 times a day. Now, in addition to that, when you sleep at night, we want your head elevated about 30 degrees. That doesn't take a lot. If you've got a bed that goes up, great, do that. If you don't, just use an extra pillow or two. I'm not asking that you sleep in a chair. And when you sleep at night, I want you to wear the ice pack. It's not going to stay cold all night, but that's okay. Remember, it has a strap, so we can apply it with just a little bit of pressure. So when you're sleeping, the ice pack gives a little bit of pressure to reduce swelling. Now, added bonus, if you toss and turn a little, the ice pack will protect the sutures so you don't tear them when you're tossing and turning at night. Now, with that strict icing routine, you can imagine your activity is going to be restricted. That first week, you can be up and about, you can go for a walk, you can do light housework, but don't do much more than that. As long as you can get your icing in, your activity should be fine. Now, if you're overdoing it, everything will start to throb. And if it starts to throb and pound, ice some more and cut back your activity. Once the icing is done, that second